not just on top of blood pressure, it's a global assessment.
You may have your blood pressure checked regularly, but Arkansas Heart Hospital's Dr. Monica Lowe says you should consider a heart screening.
Keep the Beat is a simple tool that we can use that you can spend just an hour or two of your time, go through blood tests such as cholesterol screening, diabetes screening, and then checking your blood pressure, checking your carotid arteries, and also getting a CT calcium score to see if there's hardenings of your heart vessels, and also then looking at blockages in your leg arteries, and also looking to see if you have risk factors for sleep apnea.
Which is something more Arkansans need to do. Arkansas has the 5th highest death rate from heart disease.
I think diet has a lot to do with it, lifestyle.
Dr. Lowe says most patients she's seen say they had no idea something could be wrong.
A lot of patients are surprised.
She says there are several symptoms of heart disease: dizziness, chest pressure, heart racing, and shortness of breath. But Dr. Lowe says even if you don't have any of these symptoms, you should still consider a screening, especially if you have family history of heart disease.
If they just sometimes even feel fatigued or feel like something's not right, do not ignore those symptoms. Get checked out.
A screening at the hospital costs $100 and should only take 2 to 3 hours of your time.
So for everything that Keep the Beat does, for blood tests, EKG, and then the CT scores, $100 is actually relatively inexpensive.
An inexpensive way that could save your life. For today's Heartbeat, I'm Maxine Ridling.